Hey, Sarah here. Let's talk about how do I know if my young child or student has autism? We're going to be exploring the early signs of autism that can be detected by caregivers and by teachers. So, what are the signs of autism? There's a lot of information out on the internet, and the sources I have come from the textbook I use for my Foundations of Autism class and also the OARs, which are the Oregon rules for assessing kids with autism. So this is a chart that comes from the textbook, Learners on the Autism Spectrum. So there's 3 different categories here. So we'll just kind of go through these. Social, so we'll see some delays in poor eye contact. Kids will not want to look at you. They'll look anywhere but your eyes. Lack of sharing interest and enjoyment with others. Failure to respond to his or her name. It's almost as if you might detect that they have a hearing loss because when you call their name, they don't orient to their name. They don't look when you call their name. Appears disinterested in or unaware of others. So, some other things to really be aware of that aren't on this little bulleted list here in the area of social. There's deficits in social, emotional, or reciprocity. That's kind of like the social approach and failure of normal back and forth conversation. Or it could be a reduce of interest, again, emotions or affect or failure to initiate or respond to social interaction. So, like if a kid were to go up to a child who might have autism, they really are not interested in that interaction at all. They'd rather kind of keep doing what they're doing, like maybe throwing the pebbles or sand or something with an inanimate object, but they're really not interested in that social exchange. Another one is deficits in nonverbal communication, used for social interactions. That ranges, for example, from poorly integrated verbal and nonverbal communication to abnormalities in, again, eye contact, like we mentioned before, but also body language or deficits in understanding the use of gestures. So, like pointing, that type of thing, to total lack of facial expressions and nonverbal communication. So, that fits into that social piece here. One last one for social that you want to be aware of is deficits in developing, maintaining, and understanding relationships. And this can range for example, from difficulties adjusting behavior to suit various social contexts. So we act one way maybe at a birthday party and a different way at preschool. So like the ability to not to really understand the social context that the student's in. Difficulties in sharing imaginative play or in making friends to absence of interests in peers, just absolutely not interested in peers around them. So jumping to this communication piece, we'll just read these bullet points off. Lack of gestures, again, pointing, reaching, waving, and showing. The student might not appear to understand simple questions or directions. That's considered receptive understanding or receptive communication. Speaks in an abnormal tone of voice or with an odd rhythm. So sometimes kids might be called something like a little professor, where they kind of speak in more kind of advanced vocabulary for their age. They might have a very monotone sound to their voice, almost like robotic, with not a lot of inflection, like inflection for questions going with the sound of the words don't kind of have that natural rhythm. The last one here, communication, they may repeat words or phrases exactly as heard, but don't understand how to use them. So this is one, sometimes it's called scripting, where a student might hear or learner might hear something from like a television show that they like to watch, an ad on TV, and they're just repeating it. It could be also called echolalia. There's something called immediate echolalia, which is what they repeat right after you, or something called delayed echolalia, where they heard it a long time ago or that morning and they're still saying it and it's later in the day. Um, so jumping down to behavior, jumping to behavior, repeating the same actions or movements over and over again. That is kinda like the insistence on sameness being inflexible, but also it could be like a stereotyped repetitive motor movement or use of objects, and it actually can be within speech again, kinda like that scripting or echolalia. Simple motor stereotypes, lining up toys or flipping objects, using kinda idiosyncratic phrases. Again, here, the second bullet point develops specific routines and rituals and becomes upset at the slightest change. If your child is extremely rigid and really cannot handle any change in their routine, for example, someone who drives their car to preschool, drives your child to preschool, and they insist you go the same way because if you break that routine or ritual, they get very, very inflexible, maybe crying, having a meltdown, that type of thing, is preoccupied with a narrow topic of interest. Kids with autism have something called special interest areas. There are some strengths to that because kids can become very, very knowledgeable on a subject, which is great. And it can also be a hindrance if they have a hard time shifting focus from that special interest area. So, at a glance, these are kind of the big, I would say, developmental domains that you want to look for, and some key things that might be delayed within those domains. There's a few other that I don't want us to forget. These first two are not part of the eligibility criteria in Oregon, in the state that I know the most about. But oftentimes, sleep disturbances are a big common denominator among kids that have autism and can be kind of an early thing to watch out for. If you are starting to see a lot of sleep disturbances, such as having like delayed onset of sleep, aka going to sleep really, really late, or night waking, or super early waking, you want to clue in your pediatrician really to all of these signs, but that's a big one to kind of work out and make sure you're sharing that one. Food selectivity oftentimes is based on sensory issues for food, the smell, the taste, the texture. But again, not part of the eligibility criteria, but it is a huge common denominator among kids that have autism spectrum disorder. This last one here actually is part of the eligibility criteria, so I wanted to make sure we talked about this. This is sensory processing disorders. So you're looking for hyper or hypo reactivity to sensory input or unusual interest in sensory aspects of the environment. So what you're looking for here is like an apparent indifference to pain, temperature, etc., or adverse responses to specific sounds or textures, and excessive smelling or touching of objects. So you're looking at the hyper or the hyporeactivity to these things. Visual fascination with lights or movement. So if you have a little one who is very preoccupied with looking at a light, and oftentimes they'll do something called like side glancing or side looking at the light. That's kind of a one of the signs. So you want to kind of be aware of that sensory piece. That alone does not necessarily mean autism's present, but it is part of the eligibility, again, for determining autism. If you have a kiddo, for example, who refuses as a toddler to walk on the grass because the feel of the grass just drives them, just sends them through the roof, that's something to make note of. Again, talk to your pediatrician about any and all of these signs that we just shared. One note, going back to the social skills piece, is that um, a lot of times, well, I guess autism is developmentally evaluated and detected. So, in other words, there's not like a blood test or anything like that to determine autism. It is behaviorally diagnosed, and oftentimes when we start to see the social skills demands increase. So, as kids do get a little bit older, our children with autism often start to lag socially, right behind, and this is the time we start really seeing the social delays when students are in early learning centers. Like, when I think about that, I'm thinking like daycare centers, even some early preschool centers. Their skill delays may not be quite as evident as when they start to get a little bit older. By 3rd, 4th grade, those social demands start really ramping up. So we want to detect autism as soon as possible for a variety of reasons, but also don't want our kids to start really having social challenges in those upper grades. So when we're thinking about early screening tools for autism, now that we know the signs, we want to make sure those are things that we are taking note of, anecdotally writing down, um, sharing with families if we are providers, if we're professionals. But there are a variety of professional screening tools out there for autism. There's some that are focused on the early toddler years, 0 to 5 population, and then there's some that are school age. I'll just focus on one that is intended for the toddler, the early childhood audience that is very readily accessible. If you are a parent or caregiver and you are seeing signs of autism, I would say one of the first things you want to do is check with the pediatrician to see if they have any screening tools for autism. They should have at least a general type of developmental screener, such as an ages and stages questionnaire, which is shortened to ASQ. They may not have one specifically for autism, but it's something that you can certainly ask about. The one that I'm going to show you actually is readily available on the internet, so you can maybe mention that this tool. It's called the MChat. So it stands for Modified Checklist for Autism in Toddlers Revised, MChat. And you can go on mchat.org to find out more information. But here's just a screenshot of the first 6 questions on here. So I'm just going to read a few of these. And it's very, very simple for caregivers to fill out. So really, you just answer these with your child in mind. And then keep in mind how your child usually behaves. If you've seen your child do the behaviors a few times, but he or she does not usually do it, then please answer no. So please circle yes or no for every question. Okay, so number one, for example, if you point to something across the room, does your child look at it? For example, if you point at a toy or an animal, does your child look at the toy or animal? So to me, this is looking for something called joint attention. Are they able to maintain joint attention with an adult and share fun, share activities with an adult, or are they really just kind of locked into solo play and not able to kind of orient to what an adult is having them share an interest in? Number two is, have you ever wondered if your child might be deaf? We've talked about this earlier, where if you're calling their name and they're never responding, that could be a sign. Again, if it always happens, a lot of times kids can get very engrossed in play. So, this is something that you want to make sure and check off if that's happening quite a bit. Does your child play pretend or make believe? So, this is their ability to kind of have social skills that are age typical, um, within the range of kind of typical development. Preschool age children start to kind of develop symbolic play where they might say, okay, we're going to pretend this block is a cell phone and let's call and order pizza or whatever it is that they're playing with. Or let's pretend that we are dinosaurs or princesses. That is something that you want to watch out for. If they have no imaginative play by those preschool years, that's something to consider. Does your child like climbing things? You know, to be quite honest, I'm not 100% sure what this is looking for. I know sometimes kids on the spectrum are often kind of clumsy. Um, and sometimes gross motor delays do come with autism, so maybe they're targeting this. Um, does your child make unusual finger movements near his or her eyes? So this is something that you want to look for. That's that more self-stimulatory behavior, maybe going into the hyposensitivity of sensory input or unusual interest in sensory aspects of their environment. Last one, we'll just go through these. Does your child point with one finger to ask for something or to get help? So this is that nonverbal communication. So are they able to point to things? It's part of communication that they first start pointing to things as a way to indicate what they want. So off the top of my head, I don't remember how many questions are on here, but it's just that simple. It's just a yes or no. You do want a professional to be able to calibrate this and look at this. So if you're doing this at home, you want to kind of loop in a professional that understands this. Preschool teacher who has some experience, early intervention specialist, a pediatrician, etc. So, why is it so important to find autism as early as possible? And really, the key here is early intervention. The research really shows that the earlier we can intervene with our students with autism and our learners on the spectrum, the better outcomes they have long term. So, one of the most research based interventions out there is something called applied behavior analysis. It's the longest term intervention that's been around for a long time. It is an umbrella that has many different interventions underneath it. So it's a really good one to look into for early intervention services. You also want to consider things such as maybe speech therapy, occupational therapy. These are both interventions that, if we address them early, we really see a great impact with our children. Another intervention that's out there that is supported for kids with autism is something called parent implemented intervention. Actually, it's PMII, it's parent implemented intervention and instruction. And what it really is you have an early intervention specialist who acts as more or less the coach, who coaches the family in order to provide the services within their home. Unfortunately, there is in many communities a lack of service providers and or a really long wait list to get in. So the more families and caregivers can get involved in their children's education, and the more parents can learn techniques to support communication, behavior, general functioning, the better. Because that time, that precious time before intervention starts, is so valuable that parents and caregivers actually can really fill in the gaps. So, for professionals, one key skill that we want to work on and develop is our ability to coach and train parents, because they really are the first teachers and the interventionists and teachers for their child's entire life. So, the more we can learn to coach and kind of teach what we're doing, the better off for all the families. But if you ever wonder, why do kids slip through the cracks and not get diagnosed? And just as a little mention here, diagnosis is a medical term. In education, we use the term educational eligibility. So really, and this is really just from my experience, this slide here. Oftentimes there is a lack of education in the field. So I should have put here lack really. Um, but if a professional is educated on what the signs are and what to look for, they will often help detect and find kids that have autism earlier and earlier. Um, Autism is one of those topics that I don't know that there's a lot of information out there. So it's something to kind of continually professionally find PDUs and professional development opportunities for this. Go to the research, go find other knowledgeable specialists in the field to get information. But really, that's one of the reasons why we see kids slip through the cracks. And sometimes, oftentimes I actually will still see kids in high school and even adults getting diagnosed with autism, and basically their whole life has been explained at that point. Wow, that's why I am the way I am. And they might have been misdiagnosed as having maybe anxiety, depression, many other things, that maybe there is a differential diagnosis there that was missed in autism. One piece I want to point out is ACEs, which are adverse childhood experiences. There is some research out there that's kind of emerging that shows that when children do have ACEs, which are considered abuse, neglect, and household dysfunction, that there can be a delay in getting kids the services and even the identification they need. A lot of times, parents, especially, let's just say household dysfunction like poverty, divorce, for example, they do tie up a lot of the emotional bandwidth of the family. So they don't have as much emotional reserves, um, or again, emotional bandwidth to be able to get the child what they need, educationally and those developmental, screeners might be missed, developmental signs might be missed. So ACEs is ones that we wanna be aware of, especially as professionals to make sure that that's not a reason or becoming a barrier for getting the child what they need. Um, and then kids with high academic skills, are not as easily to detect. Some people in the field might not like the term, or some people might not like the term high functioning. But this is a kid who maybe has, either average or actually above average skills in math, reading ELA, that type of thing. And their social skills might just not be as obvious or might not be as big of a concern, again, when they're younger, but they might become more of a concern later. That might be the kind of kid who gets detected later versus earlier. And so they might slip through the cracks versus a kid who really presents, a lot of the ASD characteristics all at once from a young age. They might, be more apt to slip through the cracks. And then one last thing to think about is girls on the spectrum do often present differently than boys. Most if not all of the autism evaluations, so we talked about screeners, but once they don't pass the screeners, basically need further evaluation, all to my knowledge of the assessments are normed on more of a boy population, so they really are not necessarily capturing, girls on the spectrum. One of the things that is interesting about girls on the spectrum is that they often learn to do something called masking, which is essentially hiding the social delays and behavioral delays that they have. And whenever someone is spending their whole life hiding, who they truly are, it can be very tiring. It can produce things like anxiety, a sense of feeling depressed because they can't be who they are. So they will often get, a diagnosis of something different than autism. So that is one thing to look at, and they will sometimes, again, slip through the cracks. When we think of who are the first responders to detect autism in young children, really teachers of any age, but especially those early childhood teachers, the teachers that teach daycare, childcare, preschool, even K-1, 2, um, for kids that are more, high functioning, more or less in kinder and first, second grade. They may not have been detected yet, but these are the things that it's really, really important for teachers to be able to identify and start to notice the signs of autism so we don't have kids slip through the cracks. And then again, parents and caregivers, you're number one for making sure that, your child gets what they need and gets the services they need. So please reach out to professionals and let them know what you're seeing at home. And again, your pediatrician is a really good resource, especially for those early years, before kids start going to school. So, just to share one of my sources, this is a textbook I mentioned, Learners on the Autism Spectrum by Carrie Dunburn and Pamela Wolfberg. So, thank you so much for listening today. And I hope that helped clear up and just make you feel more comfortable with what the early signs are of autism. Thank you for watching. And also, I appreciate you being an inclusive and supportive educator.